So today we have my friend Mersini joining us.
Hello.
And Mersini was also a coordinator for the Tokyo Pregnancy Group. And Mersini, how many weeks are you?
I'm currently at 39 weeks, so it could happen any day now, Kate. Bit nervous.
Very exciting.
It is exciting.
So already next week?
Yes.
Today Mersini is going to show us what she's packed in her bags for the hospital next week for birth.
So, technology-wise, I've got my iPod for some music. I've also got my Kindle. I don't know how available I'll be to read during the birth, but definitely afterwards, if I have a few minutes to myself, that's available for me. Telephone, very important. Notifying everyone of the great event. Okay, I've also packed this book, What to Expect When You're Breastfeeding and What If You Can't. The first time I'll be trying to breastfeed the baby is while in hospital. So this is a guide, it kind of troubleshoots any issues you may have. So I just thought it'd be handy to have at the hospital those first few days in case I need it. Camera, very important. And what's also very important is to remember to charge it up soon before, or not long before the baby's due, because if you do it months ahead, the battery could die, and then it'd be one of the worst times in your life to have your camera battery run out. So very important to catch all those special moments. I've also been told that a lot of the hospitals here don't supply towels for the patients, so I don't know if my hospital will fall into that category, so I've just packed my own towel in case. So another face towel just for the days after the birth again, while I'm there with the baby, and a big fluffy bath towel as well. So if I've also got sanitary pads. These are a necessity after the birth. I know that the hospital will probably supply, or definitely supply them, but I don't know what theirs are like in terms of quality and what have you. So I just thought I'd play it safe and take something that I know is a good product. So that's that there. Got a few more. And a few more. Which I know I won't need all of, but they're all different. So I just thought if one doesn't work for me, I can try a different one. My Toiletries bag. So this one was a bit tricky to pack because a few of the products that I would normally use at home, I thought I wouldn't be using straight after having the baby. So I'll give you an example. With my deodorant, I normally use a spray-on deodorant, but for the hospital I've packed like a rub-on type, and that's purely because I don't want to be spraying any chemicals in the immediate environment of the baby or of other patients or babies. I just thought it's a bit safer, just so that no babies are inhaling anything they shouldn't be. Also just shampoo and conditioner, tissues. It's winter here in Japan at the moment. I might be sneezing. Some Lanolin and also some pawpaw ointment. This particular Lanolin I bought from Australia, and it's not especially for breastfeeding. There are special Lanolin creams for breastfeeding for the actual nipples, which is safe for the baby. This one isn't, the baby's mouth won't go anywhere near it. I'm planning on using this on my tummy area in case of any stretch marks that may result after the birth. And same with the pawpaw ointment. This is good as a lip balm. I also know that a lot of women use it as a diaper rash for the baby, or even if the baby has got any type of rash on the cheeks. And also I've heard this is great for any skin conditions such as stretch marks or what have you. So these are just backup, don't know if I'll need them, but it's good to have them there. So in this bag I've got a pair of flip-flops. I thought about packing slippers, however the hospital here, when I visited it, it's very warm, so I know I won't need warm slippers and flip-flops will be sufficient. And that's just for walking around the ward or walking from my room to the nursery or whenever I've got some footwear. The remaining items are just clothing basically for me. So initially I packed quite warmer items, seeing as it is winter here. And actually I've seems that I've left them in here. So just older pyjama trousers. However, as I mentioned earlier, the hospital here is quite warm from what I've seen. So I don't think I'll need to wear those. And I've packed just older singlet style tops, which, you know, are close to being thrown out really, but they'll serve the purpose at the hospital. So if they get milk and baby vomit and anything else all over them, it won't be a huge issue to just throw them straight out if I need to. So again, another singlet top. Another reason I thought the singlet tops would be preferable is because if I am nursing, they're quite easy to just pull down. They're elasticized, so I can just pull down the actual singlet, unlatch the maternity bra, and I'm ready for feeding. I don't know, I mean, I'm trying for a natural birth, but it may turn out that I need a C-section, in which case I'm not sure how mobile I'll be in terms of wanting to bend over and pull these shorts over my legs and then back off and on and off and what have you. So I've packed this just nightie, it's a one piece, very loose, comfortable. I'll also be able to pull it down for feeding if need be. So that's something I've got as a backup plan as well for comfort. Another thing that a lot of women like to have with them in hospital, not so much for the birth but more in preparation for going home, is their actual diaper bag or nappy bag or baby bag. I like to call it the baby bag. And this is what I will use to carry all the baby items after baby is born. I don't know how warm or comfortable or convenient the clothing that the hospital will supply will be, so I'd like to know that I've already prepared what baby will be dressed in when coming home with us. So that's just another option to put all the baby's things into. So there you go.